The International Society of Nephrology, as the leading global organization dedicated to advancing kidney health, continues to build its global network and programs to facilitate and promote the provision of sustainable, equitable, and ethical care for people with kidney disease in all countries and regions of the world. ISAN calls on WHO and its member states to heighten the awareness of the clinical, economic, and social burdens of NCDs, including kidney disease, which are at present still largely underestimated. In 2015, it's estimated that chronic kidney disease, or CKD, was the direct cause of death of 1.23 million people worldwide. CKD is one of the few causes of death that is still increasing, and the global mortality rate has increased by almost 50% over the last 25 years, far exceeding the percentage change of most other NCDs, infections, and injuries. Acute kidney injury is estimated to cause around 2 million deaths annually. Diagnosis and treatment of kidney disease are costly and are not accessible in many regions due to either lack of awareness or lack of resources, or both. In such instances, provision of renal replacement therapy depends primarily on whether the patient has health insurance or can afford the treatment by other means, such as taking on loans, selling property, support from employers, or charity. Prevention of kidney disease is therefore key to reducing the global burden of disease and eradicating poverty. Furthermore, kidney disease is fraught with inequity, making it pivotal to a number of sustainable development goals beyond health. The likelihood of developing kidney disease increases with poverty, with gender inequality and discrimination, lack of education, lack of access to clean water and sanitation, weak maternal and child health and primary care services, lack of universal health coverage, wars, and some environmental and occupational risks. Exposures. Kidney disease risk begins in utero and the prevalence increases with age. Therefore, kidney disease risk spans the spectrum of human condition and the entire life course and bridges communicable and non-communicable diseases. A broad system-wide approach is therefore required to tackle the problem of kidney disease. Given the synergies between kidney disease and cardiovascular disease, hypertension, and diabetes, as well as the linkages with multiple infections such as HIV, malaria, diarrheal illnesses, pneumonia, opportunities do exist to develop integrated screening and disease management programs to improve early detection, treatment, tracking, and management of all NCDs relevant in the member states. Such strategies would create knock-on effects for the overall well-being of the populations and economies of scope for health budgets. ISAN therefore strongly urges member states to recognize the need for an integrated approach in the fight against NCDs, to deliver on SDG 3 and to promote a health in all policy approach critical to achieving all SDGs. We are hopeful that the holistic approach of the SDG promises to have a positive impact on kidney disease globally.